Our family is the Gulino family, and we're from Cape Elizabeth, Maine, and we are here today in Washington, D.C. to talk about healthcare reform for children, all children in the United States.
For healthcare reform, it's important to focus on children and families because we need to have the right care in place and the right coverage in place to keep families together during this process of reforming our healthcare system.
I think it's important that all children have access to health care because health care is not a privilege. It shouldn't be reliant upon whether your parents work or whether you meet a certain criteria to get free coverage. It's something that should be a right for every child in the United States.
All children need to have health care coverage, and it's difficult for us to understand that until you step back and think about the fact that 100 years ago, not everyone had education. And then we came around to realize all children from K through 12 should be entitled to an education, no matter what their walk of life. And nobody second guesses that decision today. And 100 years from now, after we've had universal health care coverage, it'll be the same way. People will step back and say, it would be absurd to think of any other way.
I believe that healthcare needs to be accessible. It needs to be accessible and easy to navigate so that you can have the services, but you need to be able to actually access them. And it's important specifically for parents because parents are ultimately the advocates for children.
My message to members of Congress is that if we broaden the coverage, it will, in essence, simplify the system because the parents will no longer be trying to figure out if they're covered or not covered. They will know up front they're covered, and it will simplify the whole process for the families.
Hey, Gregory, I have a question for you. What do you think about having health care for all kids? Thumbs up.
Good job, man. Good job. All right.